Nearly 900,000 people in Michigan have insurance that they didn't have before the Affordable Care Act. That's according to the Michigan League for Public Policy. But Donald Trump's threats to repeal Obamacare have many worried they'll be left out in the cold. Fox 47's Christopher Lane spoke with a family who says Obamacare is their only option.
Almost 900,000 people in Michigan have health care through the Affordable Care Act.
Really good for the people that need it.
But once President-elect Trump takes office on January 20th, they might not have it for much longer. Daniel Pratt is one of those who has insurance thanks to the Affordable Care Act, and he says if it were repealed,
we wouldn't be able to afford health care. We just physically couldn't do it. It would be crushing financially.
Pratt is self-employed, and his wife left her job to take care of their daughter, which means insurance isn't a possibility if it isn't through Obamacare.
By the time you figure in a mortgage and, we have a 4-year-old, groceries and, auto insurance and car payments, there isn't any room left for, $800 a month. I mean, that's a mortgage payment. That's where you're living.
Others, like Dave OHare, expect Obamacare to be repealed, but he knows people who have their insurance through the Affordable Care Act with cancer who desperately need their health care.
Don't know what's going to happen with them, and that does really concern me.
OHare does believe there should be a change. What a replacement looks like, though, he isn't sure.
The whole thing about pre-existing conditions, I hope that's part of the replace. If it isn't, I think we're going to have, a lot of people are going to be in a world of hurt.
Groups like the Michigan League of Public Policy say Michigan shows how successful the Affordable Care Act can be and hope it's remodeled rather than repealed.
We're hoping that Congress and President-elect Trump will look to Michigan as a model to see where this actually worked out okay.
Christopher Lane, Fox 47 News.
You can enroll for coverage under the ACA through January 31st.